lives, due to lack of time and lack of awareness, and also sometimes a lack of need, we often encounter situations where we don't have the answers to common health related questions. We lack the expertise to make good choices for our health because of this information gap. Hi, I am Neha Rastogi, one of the founders of Agatsa. Considering this very important aspect, Agatsa brings SanketTalks to you, a fortnightly series where we bring experts to the table from various health domains to debunk myths, address misconceptions and answer your questions. So जल्दी से like, share and subscribe कर लीजिए क्योंकि यहाँ मिलेंगे आपको healthy रहने के संकेत. Today we are celebrating International Women's Day, an event of global importance that amplifies women's issues. On this occasion, we want to talk about bridging the gender gap in cardiac awareness. Women around the globe still lack awareness of cardiac health and access to right and quality treatment. In India alone, heart diseases are the leading cause of death for almost 18% of women. To address this important problem, we need to talk about including women in cardiac issues and raising awareness about common symptoms, problems, and management of cardiac issues in women. Today, we have a highly accomplished and inspiring woman in our house to talk about women's cardiac health. Dr. Vanita Arora is a senior consultant cardiac electrophysiologist and interventional cardiologist at Apollo Hospitals, Sarita, Vihar, New Delhi. Thanks a lot, Dr. Vanita, for joining SanketTalks today.
Thank you. Thank you, Neha, for the kind introduction.
So, Dr. Vanita, you are someone who is in such a noble profession, which is full of challenges, that too dealing with the most complex organ of our bodies, heart. But along with being a doctor, you are a woman yourself. You have accomplished so much in your career, so it would be great to tell our audience a bit about yourself. What inspired you to pursue this career?
Well, the inspiration to become a doctor was from my mother, and she wanted to be a doctor herself, but somehow because of the family circumstances, she couldn't be. So she told my father whenever she has a daughter, she wants her to be a doctor. So I grew up probably, knowing that I have to be a doctor. Having said that, the further inspiration to choose my career path actually came with the fact that, if you tell me this is impossible, I can never accept it. I say impossible says I am possible. Yes. So I never take no as an answer. You just go ahead and tell me this is not, ma'am, you cannot do this. This is not possible. I will definitely do this. So that kind of an attitude has taken me forward to strive in a man's world and take medicine as a career, and then take cardiology as a career, and above that take cardiac electrophysiology. I'm the first lady electrophysiologist of the country. Before me they were all males, and after me there are 5-6 females now who have taken cardiac electrophysiology as their career. But I've been 25 years in this field. But you see how, just imagine how difficult my path would have been. I would not say difficult, I would say challenging. My path would have been. I use the word difficult, I use the word challenge. Whenever a challenge comes, I take it up and, I just move forward.
So it's so heartening to know that the inspiration behind your journey is a woman like your mother, and you are the first electrophysiologist of the country. So nothing can be more inspiring than that, ma'am, on Women's Day. So since it's Women's Day today, and the theme for this International Women's Day is inspiring inclusion. So I want to ask you, was there ever a time in your career when you felt underrepresented or excluded? And if yes, how did you deal with that?
Yes, there was a time. Why should I say was a time? It still happens. The voice is missing at so many platforms where it should be there. And that's my voice. And I do feel that there is underrepresentation of females in our profession, and there is underrepresentation. I have been so many times put against a challenge. It is as if I'm just not good enough because of being a female. From my male colleagues, I was discriminated because I'm a female. It has happened so many times. Like if I would crack an exam in the first attempt where my male colleagues could not, it was because I would charm the examiners. Not that I was, intellectual or I worked hard for what I have got it. Today, even this is a sad thing, even today, it happens that I am discriminated against my male colleagues. The resistance still stands. All I would say, Neha, that with time you get matured more. These things don't trouble you; they challenge you more to become more determined to achieving what you want, to getting where you have to be, and that path becomes more clearer, and you are more determined to achieve it. So it's like the more resistance comes, the more you push back. And that's what has happened. That attitude of mine has become like that. So probably with this attitude, I am moving forward, and I am, taking care of all the challenges that come to my clinical world, and that's how things are happening. And that is my message to everybody, each and every woman who is out there to facing this challenge, to go forward, never give up, take every challenge in a positive beat. It is always there to make you better, and God has created a path for you, and humans are nobody to deviate you from that path. So you are there to achieve, and you will achieve.
Definitely. And this is a very inspirational message to every woman who's out there and has taken a different path. Because many women actually inhibit themselves, and they don't go out there just for the with the fear that they wouldn't be accepted. But then now things are changing, and women like yourself definitely are inspiring women like us. So now I have a real fun question for you. If you have to describe your personality in 3 words, what would that be?
That's an interesting thought you want me to say. I would say my emotions govern me as a personality. So I am emotional, I am focused, and I am determined for success.
Wow. That was so inspirational, ma'am. So talking about inclusion, we often have this notion and belief that cardiac diseases are more prominent in men and lesser in women. Women are often unaware of the risks of cardiac problems they are in, and so today we want to talk to you about these issues on this very important topic of bridging the gender gap in cardiac awareness. Many people believe that cardiac diseases mostly happen to men only. So is that true? And if not, then what are the common symptoms, and how do the women identify cardiac risks in them?
Neha, that's a very important question. See, if you would have asked me this question about 15 years ago, 10, 15 years ago, I would have said yes, coronary artery disease, cardiac issues are the disease of men. But now things have changed. The coronary artery disease is striking equally men and women both. The earlier we used to believe that it is the estrogens that protect women. So till menopause they are protected. It only happens after menopause. Now we are seeing younger women, 25, 27, 30 years of age, who are coming with chest pain, who are coming with discomfort, with heart attacks, and we are taking care of them, right? Now, why this is happening? Why this sudden change in last 10 years? It is because our lifestyle has totally changed. Right. Women have become active member. They are no more a passive member. They are no more just the homemakers. They are going head to toe with the men to support the families. They work more than men. See, a woman who starts to work, she has to take care of the homework as well as the work. Right? How expected to do homework, when they are working, right? It's their expectation that when they reach home, thali milegi, parosi hui khana milega aapko, theek hai, aur koi taange bhi पैर bhi dabayega. Women ko to ye milta hi nahi hai. I mean, they are on the go at all the times. So the stress of workplace and family place, balancing it out, that is a huge impact on the women. Then the eating habits have really become bad. We are onto the junk food all the time. time. When was the last you brought the tiffin from home? Try to make that difference. Take your tiffins from home, have the home food while you are at the workplace. It really makes a difference. Then the incidence of smoking has gone up very dramatic, especially in females. Now, smoking and the contraceptive pills that we take to avoid pregnancy, that combination is actually the worst combination you can ever have. Okay. So if you are taking anti pregnancy pills, please do not smoke at all. That combination is the worst combination you can ever have. And above that, the pollution has contributed towards coronary artery disease. Pollution doesn't see whether it is a male or a female. They enter the coronary arteries and the lungs are equally destroyed. So these are the major factors. Basically, it is there. Then the prevalence of diabetes, is coming up so hugely. We are the diabetic capital of the world, and diabetes forms the most important factor for coronary artery disease. All these factors combined have changed the natural history of coronary artery disease in women. So we are having more and more young females, who are having coronary artery disease.
I think this is a very important piece of information. Even myself, I am a mother, and I did not know that smoking and contraceptive pills if taken together, they affect your heart. So this is really, going to help. This information, I think, should really help women out there who's listening to you right now. So women undergo many physical, emotional, psychological changes in her lifetime, and there are various stages like adolescence and pregnancy and then middle age. Could you please address some misconceptions about women's health during these stages, such as assuming that symptoms are just part of aging, or a pregnant woman should eat more and then the weight gain and the corresponding cardiac diseases after that? So could you tell us these misconceptions?
Misconceptions as regarding aging is concerned, we all are aging. But, most of the time what we do is we make it as an excuse to hide our symptoms. And it happens in females. Whenever a female patient comes to me, I always analyze her history with a huge amount of suspicion, because the females being the backbone of the family, they never put themselves first. They always put them last, not realizing that they are the backbone of the family. So if they will take care of their health well, then only the family health will be okay, no? You need to be that support. So she has to feel healthy. Now, most of the time what I have seen is that females always keep their health last. Hence, they will underplay their symptoms. So if a female comes and tells me that she is having problem from 15-20 days, I am sure she is having it from at least 5-6 months, and she has been postponing the symptoms. And in case I just hunt her or I ask her more in depth, then she comes out slowly with the symptoms and telling that, she's actually not been feeling well for so long time. So my first suggestion is never underplay your symptoms. You have to be healthy. भगवान से जब मांगते हैं ना, तो हमें मांगना चाहिए, हमें हेल्थ दो, खुशियां दो, पैसा तो कमा ही लेंगे.
जी, बिल्कुल.
राइट देयर, पैसे तो कमा ही लेंगे हम लोग. पैसे तो कमाना आसान है, लेकिन हेल्थ कमाना बड़ा मुश्किल है.
If you're healthy, then obviously
खुशी कमाना बड़ा मुश्किल है.
बिल्कुल.
Absolutely. और दूसरी बात ये है कि एजिंग के साथ साथ some things come up naturally, जैसे घुटने में दर्द होना, coronary artery disease होना, हमारा जो एपेटाइट है, जितना हम खाते हैं उतना वो हजम नहीं होता. So and plus BMI starts to decrease. So even if we were used to eating 2 chapatis पहले, अब वो 1 chapati पे you start gaining weight. It comes postmenopausal. There are so many changes that occur in the body. You have hot flashes, mood variations, you have weight gain. All these things, they put you in a back spot, and there is a huge amount of depression which comes with all these things, because आपका weight gain होता है. It's not that feel good factor नहीं होता आपके पास. आपको लगता है आप अच्छी नहीं. And being, you and me being a female, we both understand how good it is to feel good and to look good. Yes. मोटिव बहुत चाहिए होती है उसमें. So वहाँ पे कोई आपको हेल्प नहीं कर सकता, आपको खुद को ही हेल्प करना होता है. You have to be for yourself. You see, in life, I have seen there is nobody who helps you, nobody who will be positive towards you. You have to help yourself. You have to be positive about yourself. So many times comment, अरे तुम बड़ी अच्छी दिख रही हो, किसके लिए दिख रही हो? अरे मैं खुद के लिए दिख रही हूँ.
Of course.
मैं खुद के लिए किया है.
Of
अगर
course.
मैंने नया
Yeah.
सूट पहना खुद के लिए पहना है, I want to
Good.
feel good. I want to. That attitude should come in all the females, and that will help in the long run. And
Yeah.
please, pause is no joke. You have to give all the support you can to these females who are achieving menopause or who are going through the menopause, because that factor, that encouragement always remains, and it takes you long. So start to take your walks, take out me time, at least 24 hours में take out 40 minutes for yourself, जिसमें सबको कमरे से बाहर निकाल दो. No maid, no बच्चे, no husband, no in-laws, no parents, सबको बाहर निकाल दो. वो कुंडा मार लो उस कमरे में and do whatever you want to do for 40 minutes. Just be with yourself. You are the one who stays with yourself for the whole life. Give
Right.
importance
Yes.
to yourself. Love
Absolutely.
yourself.
Absolutely, ma'am. So you addressed very important topic of menopause. Any woman who's crossed 40 years of age, including myself, we have these misconceptions about menopause and how our cardiac health is getting affected, how our mental health is getting affected, what precautions to take. So obviously you have addressed them all. I really want to ask you, like, how much regular checkups and early detection of cardiac issues help in women and in people in general?
Neha, earlier we used to say that heart checkups or whole body checkup should be done for men after 40, should be done for females after 50. This is no
Okay.
longer true now. I am suggesting for 30 plus. 30 plus, you touch 30 and you should be getting a once a year checkup done. It gives
Okay.
you so much of direction in the right way. Take care of your health. You see, COVID, the 3 years of COVID has been really alarming, and it has changed our thinking and our well-being in lot of ways. We are seeing so many people dying now suddenly.
Yeah.
We are seeing so many people with depression, with tensions, with stress, with tachycardias coming up. All these symptoms have come up after COVID. COVID has told us how flickering a life can be. I'm
Yes.
using the word flickering because I don't know a better word to say that how easy it is to die.
Yeah.
That is what COVID has.
Yes.
A fragment of a virus which we can't even see with the naked eye. That has made us learn such an important topic, and we are all forgetting that. We should be
Yes.
keeping our health a priority. Nothing replaces that. Nothing replaces that. Money रह जाता है यहीं पे, घर बार सब कुछ गाड़ियां सब यहीं रह जाती हैं. It is only your health which takes care of you and takes you in the long run. So females should take care of your health. 30 plus, you should do your whole body checkup. You should do your checkup for the heart, for diabetes, for thyroid, for anemia, for breast examination, for uterus examination, and for cervical cancer examination. All these things should be included in that checkup.
Are there any resources available where women seeking more information on managing their heart health in different stages, such as some support groups or online forums that you would suggest?
There are a lot of groups on the online platform, but Neha, what I suggest is, why don't you have a group of your own at your working place or at your home place?
Yeah.
It really matters, and it really affects your mental health if you are physically present with your friends than
Yes.
being online. Online you are so many times you are inhibited to talk and tell
Yeah.
your
To strangers.
real yes, feelings, because it is always going to be on the net, and it
Yeah.
becomes a challenge. So I say develop a group. It needs to be a larger group if you are more extrovert. It needs to be a smaller group if you are an introvert, but have somebody apart from your family to talk to. Have them to share your inner feelings, your fears, your symptoms, if you are having any, your happiness. Just share with them. It really makes a difference.
Definitely. I totally agree with you, ma'am. I mean, friends and support groups, and if you have any kind of support outside your family or outside, your workplace or anything, it really helps a lot. Being a busy professional and managing different roles in your personal and professional life, can you stress the importance of self-care and prioritizing mental well-being also? Because mental health is also taking a backstage, and in today's time, we know that every third person, every second person is affected by that?
Yeah, mental health is very, very important. I did mention about this earlier in the last question. Of course, see what happens is that you keep on getting into a kind of a cycle. Every day you get up, you get ready, you go to work, you work, and then come back. Then again you are working. So it becomes kind of a vicious cycle. You got to
Yeah.
break that vicious cycle. And mental health does get compromised if you are feeling low, if your self esteem is low, and you don't have anybody to listen to. Nowadays I have seen families having their dinner on the table and everybody's on the mobile. There is no
Mobile,
family
yeah.
time. That's not called family time. This is no family time.
True.
So
True.
family time comes when you are talking, when you are discussing. So my suggestion would be to take out me time for yourself. 40 minutes you spend with yourself. You want to read, you read. You want to hear music, you do that. You want to just close the door and dance on the music you like. Just 40 minutes, keep on doing whatever you feel like doing. Some people like to listen to music and they enjoy that so much. Some people try to read the book.
Yeah.
Books have absolutely gone out of fashion, with
Yeah.
Kindle and online things
Correct.
available. The book,
Correct.
I miss reading books. I love to read books from
Totally
that
second
paper. When that fragrance comes, the paper fragrance,
Yeah.
and you have changed the
Turn
leaf,
page.
you are reading
Yeah.
the how good are the italics and all. That
Yeah.
feeling is totally gone, and I enjoy that. And I make it a point that you have to take out time for yourself. See, I work in a very busy hospital. My schedule sometimes doesn't give me time to do that. You know what I do in between my cases? I just go out of the hospital. We have a huge compound around the hospital. It's some
Yeah.
parking area, some garden and all. I just take my earphones. I put on put on music on my iPhone, and I take a big round.
Break.
2-3 rounds I take outside there, and I come back totally refreshed.
Yeah.
So this 15-20 minutes of break really matters to me.
Yeah.
I have seen
It's a
people,
small
work,
thing. Yeah.
they work
Yeah.
in the offices and they'd go and take a cigarette break.
Yeah.
Why take a cigarette break? Take a chai break, yaar.
Chai
Chai
break,
pe
yeah.
masti more better than
Correct.
cigarette break.
Totally agree. So, before we conclude, ma'am, what message you've told us, different tips, and you've given us a lot of information about women cardiac health. What message, finally, you would give to women out there listening to you to be more healthy? In very small few words, like so that they can be inspired to take care of their health along with the daily chores and daily work and daily responsibilities that they are handling.
So my message to all these dear females who are out there, striving their own battles. First of all, don't take them as battles. Take them as challenges. Your attitude will make all the more the difference between what the outcome is going to be. Because if you start negatively, your outcome can never be positive. Start positively. Whatever challenges come, take them with a stride. Don't forget to smile in the day. Don't forget to do that. The frown actually takes off the energy out of you. Smile always adds the energy. Go and hug the person who gives you positive energy and who is your friend. So go and hug them. That physical contact makes a difference. And above that, have a chai time with chai or coffee time. I'm a coffee lover, so have chai or coffee time with your friends. Take out 15-20 minutes. It really matters. I just had it before coming for this interview. I just had coffee time with my besties in the hospital. So if I can do it, you all can. And don't forget, if you have symptoms, please discuss with your doctor, with your friends, and take an opinion. That is very important. Make regular checkups as a part of your yearly routine. If we diagnosed early, we can treat you better. So every year, at least once a year, take a health package, do a checkup of your health, and just stay happy. That's it.
Thank you so much, Dr. Vanita. I mean, this was really, really important piece of information that you gave us, and not just information. I think it was more inspirational to hear you out, and how you went about your journey and how you go about your day, so that everybody, each one of us, can actually get inspired and learn how to be happy and more healthy, because obviously happiness is the key to health. So thank you so much, Dr. Vanita, for joining us today, and hope to see you more often. Thank you so much.
Sure. Take care.
Thank you, ma'am. So those were some wonderful insights from Dr. Vanita about some truly important issues. We hope that this session has been useful to our audience and it helps bust common myths and misconceptions about women's heart health. Women's heart is as prone to a disease as much as a man's heart. Thank you so much for joining. Stay tuned for more such content. Thank you